Thank you, Steve, and thank you to the Institute of Medicine for this opportunity to talk a little about our efforts in community-based nursing education. I'd like to also acknowledge the support of the Academic Programs to Improve Health, which is a cooperative agreement funded by the CDC, and we work together with our colleagues from academic medicine, the public health educators, the APTR, which is the Association for Prevention, Teaching, and Research, and nursing, to try to support the rather profound paradigm shift that's occurring in healthcare in our country to population-focused health rather than episodic healthcare, a huge challenge. So what I'd like to do is introduce you to the way nursing is trying to think about this challenge and meet this challenge. So the first point that I think is important to make is that we consider community-based nursing education as a pedagogy, not particularly as a setting. And what we expect in that pedagogical approach is that students focus on community regardless of the setting in which they encounter the patient. They deliver community-focused care in acute care settings, and that means that a nursing student learns an ecological focus and carries that with them wherever they may go. It is challenging to introduce this to nursing students, and I'll be talking in a moment about how we're trying to do that. But I think that as we think about this huge shift in healthcare in our country, we do have to remember that acute care is a partner and a very important one, and I've heard that in a lot of the presentations that we've been privileged to hear today. The challenge is to remember that a patient comes from somewhere and goes somewhere, and that somewhere has to be dealt with by the student of nursing, medicine, physical therapy. So what are we doing to try and do this? The models that have been evolving in nursing at least have morphed from early episodic models where students worked intensively with the community over a limited amount of time. So they sort of saw this as an episode in their education, and they went out and did community work for a semester, perhaps two, and they learned things. They learned to assess communities, they learned health education, they learned about screening and immunization and perhaps work in the home, but they saw it very much as an experiential exposure that ended. What we've learned is that it is actually better to have sustained models where students are placed in a community home base, and they stay in that home base over 3 to 5 semesters. Some schools keep them in their home base throughout their entire 4 years of undergraduate nursing education. And as they work with communities over that extended period of time, they learn something quite different. They learn that communities change. They learn that communities evolve, and the shaping of the nursing community engagement also must evolve. They develop various projects that involve various stakeholders. I was intrigued by the thought that nurses might be educated with law enforcement personnel, because those indeed are very important community partners, and our sustained models of nursing community education have highlighted some rather unlikely partners. One of the most interesting recent models we've seen is nurses in public libraries and nursing students placed in public libraries and encountering the community when they're most interested in learning some piece of health information or engaging in some health education. So I think that this evolution is healthy and interesting. It certainly isn't a linear progression. We still have many episodic models and an evolving number of sustained models, but this is certainly one trend that we've observed. Now, the question that we have to deal with is impact. And we are beginning now to engage with that in a pilot way. It is extraordinarily difficult, and I've heard my fellow speakers address this, to figure out what the impact is of this type of education. So the impact evaluations of community academic partnerships are being supported by AACN, and we have challenged our member schools to come up with interventions that are focused in one of 4 ways. The intervention can impact the student, and you can have a look at how. How indeed have you changed the student's thinking through your interventional approach? And I've heard, again, speakers today talk about that. You can also impact the education and the faculty and how they think about educating students. This is an interesting impact because, of course, it changes the way future generations of students are exposed to knowledge. You can also impact the health of the individual consumer that you encounter in the community in various and important ways. And how do you measure that? And finally, you can impact the community itself. And that's perhaps the true measure of population health impact. So the evaluation and the findings from our initial projects will be used to support larger evaluation initiatives. We hope that as our partners learn to evaluate these impacts, they'll get better at it. And they'll get better at understanding what interventions link to the best and most useful impacts in the community. So this is by no means easy, and it's by no means straightforward, but I think the dialogue is important, and I again want to thank the IOM for the opportunity to present to you today. Thank you.
Thank you. And our next speaker on this panel is Frederick Schwartz of A.T. Still University School of Osteopathic Medicine in Arizona.